sometimes when I have a stomach ache, the last thing I want to eat is a chicken breast. Rice
Yeah.
sounds good, bread sounds good, because it seems soothing. A banana seems soothing. Is it possible that whatever stomach distress comes with semaglutide could just steer you away from protein?
Yeah, so that's it's great. God, it's great. You didn't even take the drug, but you intuitively are asking some of the questions we're asking. It needs to be studied. I'm so lucky to have like a team of amazing dietitians to where like they work with the patient closely to go like, okay, how much protein are you eating? Oh, you're not eating much. So
Right.
I think there may be something to what you're saying. I don't know. This needs to be studied. They need to go like, okay, let's look at just like giving people the drug who are it's clinically indicated, mind you, and let's just look at the quality of diet. Let's see what changes. Is it possible their percentage of protein actually goes down, or are they, or what? And then if we can tell them, hey, let's find ways to make protein more appetizing to you, because I do think, yeah, if you're not feeling so well, at least. So let me get into some of the side effects. The nausea, this stuff happens at the beginning of when you take it, and every time you go up in the dose, not every time, some people tolerate it just fine. For most people, it's mild to moderate. Minority of time, it's moderate to severe. The last person, those people are going to not want I don't want a chicken breast
No,
when I'm not feeling well. I
no.
want like easy to eat carbs.
Yeah.
Like, so I think there's possibly something to that. It has to do with the digestion as well. Over time, the nausea should resolve. If it doesn't resolve, obviously your quality of life, I don't know, is it worth staying nauseous all the time despite less weight? So over time, most people, it will resolve. And the cause of the weight loss isn't from the nausea. Over time, the satiety still stays while the nausea resolves. Now, having said that, there's, those beginning parts of weight loss are very important, because if you're losing weight mostly in the beginning, and if you're not getting enough protein, it's because you're not feeling well enough. Those are crucial periods of time to where that's why our dietitians are great. They jump in when we have side effects with patients. We'll be like, get in with this patient. They're losing weight too quickly. Let's not go up in their dose. Let's settle things down and get them on track. So I do think there's something to that. Um, and that the nausea is the most common side effect we see. So it's not a free ticket or a free lunch or whatever anybody wants to say. These drugs can have some nausea. Constipation we see sometimes too, pretty easy to resolve. More water, sometimes fiber supplementation, try to get them walking a lot, more fiber in their diet, obviously, fruits, lentils, whatever. Some people get diarrhea. It's not as common as the first two. Some people get reflux. Um, Rarely we do see, because people lose weight so quickly, you can get gallbladder disease. You develop gallstones based on the changing of the composition of your bile. So that can start creating gallstones. There may be something with the drug changing the way the gallbladder functions, which may also increase the risk of gallstones. It's rare, but it's something that people should be aware of. Um, but most commonly is nausea, and it can be minimized with lifestyle changes, what people eat, and then sometimes we have to give medicine to combat the nausea. But that's also important why you got to have a clinician that just doesn't go like, oh, all right, let's just keep cranking up your dose despite you wanting to vomit all the time. That's probably not good practice. So
Right.
throwing that out there.